Like the relationship with, you talk about wanting to do ethical when you do an appointment with your pastor of your church. And I went to, that's a big church at that point in time, really big church. Yeah, he didn't bother to tell me that he wrote a New York Times best-selling book 2 years ago. So when his Medicare premium came in and it was over $500 a month, he asked me why I lied to him.
You're on, Scott.
Welcome. Whoa, wait a minute. It's my turn.
Oh.
I'm supposed to do another introduction. So welcome to our second episode of the Medicare Academy podcast. Today's topic is working past age 65. And the question is, should you work past age 65? And if you do, what's it really mean?
Am I starting it?
Well, wait a minute. But you just said, you were like, before we went live and all that, you're like, no, I'm going first. Yeah.
And then you said, really? And I said, yes. And you said, really? I said, yes.
Yeah.
Like, really?
And now you're just all froze up and stuff.
Well, I didn't know the transition. Okay, so
it was pretty obvious. I mean, like,
This
all right,
better get better.
all right, we'll be quiet.
all right,
All right, get it together.
let's get basic here. Let's think 65, right? When you think of 65, you think of Medicare. So when you turn 65, you have to do something. Okay, so what I tell my clients is after you turn 64, let's start talking about Medicare because you have to do something. Okay, so how do I start up in Medicare? How do I get enrolled? All right, so if you want Medicare and you're already getting Social Security, when you turn 65, you don't have to do anything. Okay, you'll just get enrolled and you'll get a letter in the mail and a card and you'll be happy. Okay, if you don't, you have to actually physically enroll. Okay, now the time frame you have to enroll is called the initial enrollment period, IEP. Okay, take your 65th birthday, go 3 months back before, go 3 months after. That's your initial enrollment period. So how do you enroll then? Well, there's 3 different ways. You think I can go down to Medicare or talk to Medicare. You can't. You got to go through Social Security, correct? Okay. So I have clients that do 1 or 3 ways. Call Social Security, go down to Social Security, the local office, which some can be very friendly, or get online at Social Security and do it online. Okay? You have to do something. We talked earlier about making a decision. Even if you decide not to get Medicare, that's still a decision. Okay? So you have to do something. Now, if you don't do something in that initial enrollment period, you have to wait to what's called till January of the following year. Okay, now remember, if you don't do something, you have to wait until January of the next year. January 1 through March 31st is what is called the open enrollment period. Okay, so when that time comes, remember, this is when you don't do anything. Okay, you have to wait, and when you enroll in that open enrollment period, you're going to have what's called some penalties or a penalty, which we'll talk about later. So other than that, remember, 65, let's do something, let's talk, okay? That's what I got for you.
Well, so what do you recommend when your clients come in and they say, hey, I need to apply for Medicare? What do you say to them?
I personally, I would do it online, but I'm kind of tech savvy, maybe a little bit. But I've had people tell me good things about their local office. I've had them tell me good things about calling. And I've had people tell me good things about online. I would get online and do it. It's very simple if you already have SSA.gov account.
What if they're still working and their spouse is younger and she's on the plan with him?
Those are some variables about that. So when someone has something like that, I would want to dig into their situation, okay? And that's when they make an appointment with me. We sit down and go, okay. But still, what I want people to understand is let's talk about it prior to you turning 65 instead of waiting until you turn 65 or after, and then you may incur some penalties. So in that situation, contact me. Let's sit down and review your situation and see what you should do. Good?
Yeah, because, I mean, probably one of the biggest questions is, do I even need to enroll in Medicare?
Correct.
And you don't want to figure out the answer to that when you're turning age 65. So your recommendation is a year out. They should really be looking at this a year out.
Yeah, I know.
I agree.
Yeah.
I do too.
Yes, knowledge is cool. Knowledge is power. No, if you can get it early, then you can relieve your stress level. You'll have an idea what you're going to be doing when you approach 65.
And then you don't have that sense of, I have to do it now, so that you can think about it for a while and you can educate yourself more. There's lots of ways to educate yourself. And the more education you have, the more informed decision you're going to make.
Don't you feel like people are kind of scared to use insurance agents for such things? We don't charge anybody anything for that, but they fear our answer. But don't you think our answer is way better than the one they're going to get from somebody else, especially Medicare? I mean, not to knock them, but like they don't care about them like we care about them. I mean, that's my opinion. What do you guys think?
We're going to put it in plainer English as well, instead of just reading a screen or reading a book. We can break it down easier. And then if they have questions, they can just ask them instead of, having to email somebody or that. If we're face to face with them, they can just ask us questions. And the more questions people ask, they get the answers, then they have more questions. So it's kind of a...
Yeah, we give customized answers based on their very specific situation.
Right.
I don't believe Medicare is going to do that for them. Plus, every time if you get a relationship with a local agent, you probably have their cell phone number, and you can ask them a second question a day later or 2 days later, some 800 number. I mean, obviously, you're not going to get the same person, probably not going to get the same answer.
Well, here's another thing that we all do. We all have websites. Mine is talkmedicarescott.com. Okay.
That was a
So-
plug.
Yeah, I'm not plugging that at all. But what someone can do, and each one of us has their own personal website, is you can go on there. And I told a gentleman that was here a couple weeks ago, he was upset because he didn't trust the agents and talking. And I told him, go on my website, talkmedicarescott.com again, and it'll take you from point A to point Z. And you can look at plans, you can enroll, you can have your questions answered, and you don't have to even talk to me. And his face lit up. He was excited that he didn't have to talk to me. So that's another avenue.
That's how I feel when I have to
Yeah.
face you. If I could find a way
Right.
out of the situation. Hey, man, you learned this format quick. I mean, that was 2 really good plugs back to
thanks.
back. Man. That's gonna play well, Scott.
Thank you. Thank you very much.
I've never had anyone tell me they were intimidated or afraid to approach myself or any of the agents here. So that's never happened. But I think because we don't charge a fee, we are commissioned salespeople. Our job is to figure out what is your situation. And if there's a solution I can help you with, I will let you know. But if the solution doesn't include me, I will let you know that because you've got friends and you will let them know. Connor does know this stuff. I mean, Connor will see where are you in this because I want you as a client when it's time, and then I want you to stay as a client because it makes our lives easy.
I mean, it makes more sense that if somebody did have something to gain in the transaction, that they would probably want to earn my respect more than if it was otherwise. So
Yeah, and
it's
Right.
like the fact that we don't get paid unless we sell a program means that there's a lot of groundwork that we need to do as agents ahead of time, which we're incentivized to do that, where a government organization isn't. So you can look at it a different way. Is that kind of your point?
I think it is.
Yeah.
Yes.
Well, look at us making your point.
Yeah.
We did good.
If anyone was confused, go to Scott.
Yeah. What is it?
TalkMedicareScott.com.
Yeah.
On there, you may or may not. I need your address on there, your social. What else you want me to put on there for you?
Thank you.
Yeah. Favorite color. Yeah.
But I had a prospect this morning. He's 67. And I sent him some proposals last week, and we're talking about him. He said, I had no idea how affordable these plans and Medicare is. I've been working because I thought I had to keep this health insurance, and I was paying way more for the health insurance, and I don't like working anymore. I'm glad we talked now. I wish we'd have talked 2 years ago. Now, speaking of the price of Medicare, for the most part, Part A, people say is free. Part A is not free. Part A, you pay an income tax on, okay? So it's not free. And Medicare's been around since I've been around, which is 1965. So Medicare Part A is not free. They've been charging you a premium. If you happen to be self-employed, you get to pay that twice. You get to pay it on for yourself, and because you're the employer, you get to pay it twice. So it's not free. They don't charge an additional premium if you qualify. If you don't qualify based on your quarters, you got to work 10 years, pay income taxes. It can, depending upon how many months you have, how many quarters you have, they can charge you over $500 right now for Part A a month. Okay?
That's just A.
That's just A.
Yeah.
That's just A. Part A, which is hospitals.
That ain't free for me, is it?
It is
That ain't
not
free.
It is not free. And then, so Part B does have an additional premium. Most people pay around $175. When I say most people, they have something called an income-related Medicare adjusted amount. So if you make more money, you're going to pay more. That's not fair. That is not fair. I mean, you've been paying Part A, you've been paying more because of your income tax the whole time. Now Part B shows up, and they're going to have you pay more for Part B premium based on your income. If you don't have any income, it could be free. But because you were successful, you took a chance, you went out and you did well, you're going to pay more. Now, if your lifestyle changes, you can appeal that additional charge. Like right now for 2024, it's if you make $103,000 in one, then you're going to pay more. The breakoff's 103, okay, for an individual. But if you retire and now your income goes down, the government looks back 2 years. But you can give them a piece of paper that says, my lifestyle has changed. I've retired. So don't look back 2 years. Look back today. Here's where we are now. And I can help you get that appeal filed. It's a pretty easy process. Then also you have Medicaid can come into the equation on occasion. That's a state-run organization, state-funded, and that is just 100% on income. Has nothing to do with health insurance. It's income. And if you think you might qualify for Medicaid, I can certainly help you get to that website or get you the phone number. But if you think you might qualify for that, it doesn't cost anything to try to help. And while you're trying to help there, I can certainly help you try to qualify for extra help through Medicare that could help pay for your prescription drug premiums, co-pays, et cetera. So just the more knowledge you can get from someone that you trust, you're going to make better decisions.
So when you are working with clients, if somebody's paying the standard Part B premium for this year, $174, is your recommendation normally the most consistent one, you should go ahead and accept Medicare even if you have coverage through your employer?
Well, I guess I'm going to ask them what is important to them. Are you looking to save money? Are you comparing what the insurance is going to cover? I need to know, why are we even talking about this? What are you looking at? So if it's, let's say I'm trying to figure out if I'm getting a good value. Okay, well, let's see. How much does the employer group coverage cost you per month? And we write that down and we compare it to the 174. Okay, so now we have now let's look at the coverages. What sort of deductible does your employer coverage have? What sort of max out of pocket, if any? Those kind of things. What are the co-pays? And then we can compare based on your zip code, your county where you live, what plans are available to you. We can look at, okay, well, comparing those, this might look more attractive to you if you wanted to save money and have as good, if not better, insurance. Did that answer your question?
It did, and it really leads me into what. So I went to the Pew Research Center, pretty credible site for pulling statistics, and in preparation for today, was kind of these stats are really interesting. So did you know that in 1987, only 11% of our population that was 65 and older were participating in the workforce? Okay, so that's now gone up to to 19%, according to the Pew Research Center. So that organization says that there's a total of 11 million older Americans working today, which is almost quadruple the amount of from the mid-'80s. Okay, so that probably has to do with inflation and certain economic conditions. But it wasn't that many years ago that when somebody came to me and they say, "Hey, I'm turning 65 and I've got really good insurance through work. Do I need to file for Medicare?" My default answer of just a few years ago was probably not, because group insurance wasn't that bad. But today that is not the case. I think a lot of people freeze up and they see all the Medicare messaging out there, all the Joe Namath commercials, all the stuff on TV, even like certain Medicare insurance agencies. They get bombarded with all this mail and this messaging and penalties, and they freeze up, and they do know enough to know that, well, as long as I have creditable coverage through my employer, I really don't need to do this, which is true, as long as your coverage is creditable. But just because your coverage is creditable doesn't mean that you should do that. It's not always most cost effective. In fact, the Pew Research Center says it's not likely that it's going to make sense to continue to get your coverage through your employer after age 65. So 32%, this is another interesting fact, 32% of people 65 to 69 have jobs, and that's more than people age 18 in America.
Wow.
And that's kind of a shame. And so, well, it's kind of a crime in a way. It's right. And they expect that to go up over time. So young people aren't working, old people are working. I shouldn't say old people, it's disrespectful. But like older, mature people, a lot of people envision that at age 65 they wouldn't be working, but they are in amounts that they've never worked before. And when I ask people that approach me, "Hey, what should I do?" or people that already have group insurance, I say, "Well, why are you still working?" And the response I get mostly is, "Well, I need the health care." And check this out. So I'm going to go back to 2013. This is how group insurance looked in 2013. In 2013, and this is according to the Pew Research Center, the average person that was working age 65 that was getting their insurance through their job was paying about $380 a month in premiums. And that employer was paying about $982 of that. Okay, so more so for the employer than the employee. But today, well, this report ends December of 23. So just 2 months ago, they're reporting that the average employee is now spending just under $600 a month to own that insurance. So when you look at, Connor, and you're telling us it's only $174 a month to file for Medicare, and then you pair that up with some other Medicare Advantage plan or Medicare supplement, in almost every scenario, that's not only saving the employer a ton of money, more so for the employer, but the employee themselves, they don't have to work at age 65. They absolutely can file for Medicare and pick up a plan for usually between the Medicare and the extra coverage, it's less than what they're doing through their employer, and it's better coverage. And they don't have to work 40 hours a week to get it anymore. It's always attached to them, and now they just don't have one insurance company that they can assign themselves to. They have a whole multitude of options out there, because usually through the employer, it's like it's Anthem or it's only United, and you got 3 options. If you go on an individual plan, you have a gazillion options.
I think that most people just don't like insurance so much they don't even want to look at it. And they're afraid, because some insurance agents I've heard can be extremely boring.
Not this
What,
group.
what are you trying to say, man?
I mean,
Not this
so, but if you're willing to say, "Hey, insurance person that you kind of like and trust, here's what I have. What are my options?" It should not take very long, and it should not be painful to give you your ideas of what your options are. You might not have to work. One of my favorite parts of my job is when the people call me. "All right, I'm done. I'm walking out. I'm tired. Let's go. I'm ready to leave that business." That was the last couple years were awful, and that does my heart good.
Yeah.
And it's really, I mean, when you're comparing an employer's insurance to Medicare, it's a numbers game. I mean, it's numbers don't lie. If you just write the numbers down, you get to the bottom of the total line. Which one's less? I mean, it's not that.
Yeah, but is everybody's buying motive how much it costs?
No, but I mean that part. There's no question. There's no trust needed there. The numbers are right there. So that part is black and white. And then you get that part done, and then you go into the coverage. And I think the biggest thing is the spouse. If the spouse is covered on an employer's plan, then
That's true.
because the spouse can't get Medicare if they're under less than 65. So you might have to hang on until 67 if your wife's a couple years younger, or your husband's a couple years younger.
Or you have your insurance agent say, well, based on you retiring and your spouse being 62 and you guys make this much, here's how much that insurance would cost going through, what's available to them. So again, it's knowledge. Don't just assume you got to keep working at the place you hate so you can have health insurance.
That's true.
I mean, it doesn't take very long to get those numbers. And we have people right here in the Medicare Resource Center that can do that for you.
Yeah, another way to make it safer is do what Scott said. Do this a year out. So when you turn 64, get a good glimpse, go find an insurance agent. Preferably, you should go to iqmedicare.com. That's where I would go if I were you, or talk Medicare Scott or whatever. But it's very safe because an agent can't do anything for you unless you're within 3 months of turning 65. So you got a full 9-month window to look at things, kick tires, get an idea. We agents will not charge you anything for that advice, and you'll get a really clear picture without anybody being able to sell you anything. So that 9-month window before you turn 65 is an excellent time to go and do that research, in my opinion.
And you said on the last podcast of the Medicare Academy, you love your clients to be knowledgeable. Those are the best clients for you, correct?
That is correct. Yes.
Me as well. Yes.
So you can go to Connor at ConnorThornhill.com and you can book a phone call with me or face-to-face, whatever you want. But if you give me your information up front, your doctors who are important, your dentist who's important, your meds, tablets, et cetera, then when we get together, if we get together, because I can send it to you online as well, but it makes our meetings go so much quicker. They're very efficient. My appointments don't take more than 30 minutes unless something's crazy happened, because we want to get things done. I do want to be your friend, but I think we want to get your insurance out of the way, and then we'll be friends somewhere else.
Then we can laugh.
And we can laugh. But
Well,
you don't.
you've done a great job of making it, I wouldn't say easy, but a lot easier for people to deal with this Medicare stuff and us. I mean, how easy is it when you're sitting in your PJs at whatever midnight or whenever, 10 o'clock in the morning, watching whatever you watch, and just get on your phone and get on the website, and here we are. Oh, I can look for plans. What's this video for Medicare A, B? Oh, I mean, how easy is that? Isn't that what people do anyways? People are always like this,
Yes.
right?
I think a caveman could do it.
So
Why does the Geico
Yeah.
work so hard, though? Thank you.
you know who really works hard is someone who owns a lumber yard.
Oh, I've heard that.
Yeah.
So, Erica, you and I were discussing earlier. So you built your client, you put the person in your system, and next September, you'll send them an email. You'll send them a beautiful postcard. It's that time of year again. If you'd like us to review your options again, let me know. And you have options beginning October 1. That's when you have information on the plans that you can discuss. Can't change anybody until the 15th of October. But on October 1, you can let them know, here's where we're going to go on the 15th, so that you have a plan. So it's not hectic for them or you, right?
Exactly. And it just flows. They get their information to us, we get our information to them, and they can make an informed decision.
Do you ever have somebody resistant to give you their information ahead of the appointment?
Often, yes. Especially if it's somebody who's been referred to me by someone, not so much, because they trust the person that referred them. But if it's somebody brand new that doesn't know who I am or yes, they definitely have some hesitation. And I will say it just makes the appointment a little bit longer because I have to put in all their information when they get here. And I mean, it's their time. I mean, it's my time too. But I mean, if that makes them feel better once they meet me face to face, that's fine too. Just takes a little longer.
Like what information are they hesitant?
Their drugs and their doctors. They just think it's too personal and they don't know who I am. And
All right.
I'm fine with that.
I'm not fine with it. It drives me crazy.
I'm newer than you.
Yeah, but
I haven't been doing it quite as long.
I mean, we're not miracle workers. I can't, without the data, if you don't give me your medications and dosages and exactly how many you take and what pharmacy you go to and all your doctor's correct spelling ahead of time, then this appointment will not be a good experience for either one of us.
I don't want you to watch the top of my head while I'm typing stuff.
Thank you. Well, and it's also speaks to making mistakes. If I get that data in advance and I can go through, because what I do, we plug it into software and then we study that software and we figure out what to do with it. And so we get a nice glimpse ahead of time, well in advance of the appointment, and we kind of know what's going on. I wish that thing wasn't dinging anymore. We probably should turn that off. It's okay. No, it's good. Good. We're good. We're good. Everybody stay still. But not getting that stuff in advance of the appointment really disables the effectiveness of the appointment, because here's what goes on in my mind. I usually schedule those appointments in 2-hour blocks, meaning I give myself an hour to work with that person, which is barely enough when I get the data, but then I got to give myself space for the next appointment and to get to that appointment because they're not always in the same office. So it's easier to make mistakes as an agent if we don't get it ahead of time. And at least the way we do it, we're only telling them what's relevant to their situation, and either we can help them or we can't. And if we can't help them, I mean, I can't display a plan that isn't better than what you have. You'll know it because we compare them side by side. It's not like we can conceal anything. So anyway, that's a good point. I don't want to look at the top of my head either.
Well, hey, let me ask you this. Would any of you go or call a doctor, schedule an appointment, go in, talk to them, and why are you here today? I'm just here. Figure it out. Wouldn't you say, I have this symptom, so the doctor can help you? So when they don't provide us any information, how are we supposed to, help you?
Yeah.
No.
I'll get tougher as time goes on, I'm sure.
Well,
You
you're
will.
not going to get tougher. You're going to get more efficient, but you're going to explain to them. If you just shoot me pictures of your medications,
And some people
just
will.
text it right over to me.
Or they'll
I'll have
send-
it. It'll tell me if it's when we get together, I will have all your profile built. We will review that. That'll be fast. Then we will look at 87 choices.
Right.
Yeah, and I
Yes.
love what you showed to us earlier today. You're working with the client. I'll let you tell it. The one with the prescription drug program, it's not commissionable, but you still are going to help them get into that.
Oh,
Yeah.
right. Because when we put in all of the information and we went to the prescription drug plan in our system, in our connector, it was a plan that I don't get commission for, but it's still what the client wanted. So, that's what the client's going to get. It's not, it doesn't have anything to do with the fact that I am not going to get paid for it. It's more of making sure the client has what they want, and it's the best plan for them. So yeah, it's not, we obviously need to make money, but it's not about that. It's about educating them.
I love your heart. That was the right thing to do.
And that builds a sense of trust because I'm not just trying to sell him something just so I can make money.
Yeah.
So
That's why you have a very bright future in this place at the Medicare Resource Center. That's what we're looking for.
I believe so.
Yeah, that's what we're looking for,
Yes.
to serve people first.
And we educate so many people we've talked about this before, during the annual enrollment period, that October 15th to December 7th, when anybody can make a change to their Advantage plans and the new plans come out for the next year and all that. I educated more people than I actually wrote. But if they don't need to change, they don't need to change. You know, you go over their medications, you go over their providers, and if the formularies haven't changed, then they're happy with what they've got. Send them on and see you next October.
Yeah.
To me, that's how you build a book of business.
Here's 2 cards. Give one to your friend that might not be in the same situation.
Yeah.
I would love to look at their plan too.
Mm-hmm. Yeah.
Make sure they're set for 2024.
And those referrals, I'm learning almost a year into this. I'm learning referrals are precious.
Referrals are precious in everything you do.
Yeah.
That person that told you about that restaurant and you went to it, they were right.
Yes. Fair.
Yeah. It's a compliment in
It is.
disguise. Yeah, it's one of the best compliments you can give an agent is a referral. So, but concerning working past age 65, so when it comes to creditable coverage, which really means coverage as good as Medicare's, I want to tell you that I am a veteran and I just turned 50, and I'm looking at, what's it going to look like in 15 years for me. So right now, my VA coverage is amazing. I don't pay a premium. I don't pay a deductible. I don't pay copays on anything, including medications. And I will be faced with the decision when I turn 65 whether I want to go out and pay that $174 a month. And in my mind, it's a little silly. Why would I go do that? Well, Medicare says I have to unless I have creditable coverage. Well, certainly VA coverage is creditable, right? I don't pay copays. I don't pay it. It's not. It is on the drug part, but not on the medical part. So don't assume just because you have creditable coverage just don't assume that because you have coverage that's really good that it's creditable. You must figure that out.
How do you verify?
They're required by law to send you out a notice in advance of turning 65.
Every group
Health insurance out there, your HR manager, your company, whoever's running the show for healthcare out there, that person will send you a letter and it tells you they have to do it. A lot of people say, I didn't get it. And I'm like, well, they're supposed to do it, but let's find out.
Will they do that for VA too? Will they when you turn 65? How are you going to find out?
The VA will tell you on their website it's not creditable.
So they won't send you a letter.
They're not an employer. It's just yeah.
Well, that's good information.
knowledge.
Yeah, knowledge.
Knowledge is power.
Yeah.
Does that employer have to give you a letter every year or only if their plans change? Because couldn't a company?
I think they do it every year.
It makes sense that they would do it every year.
Because it could become non-credible.
Non-creditable.
or
So
uncreditable.
good doesn't mean it's creditable. So I could make the mistake. I could say, and I've had veterans say, hey, I've got VA. I'm not going to enroll in Medicare. Okay. Does that mean I pay a penalty, Erica?
Yes, you will. If you do not have, when you are eligible for Medicare, if you do not have credible insurance and you do not sign up for Part B, and you will pay a penalty, and it is, you will pay every 12-month period, you'll pay a 10% penalty. And unfortunately, that penalty will carry through with you until you no longer have Medicare. So the rest of your life.
What about the 67-year-old gentleman I spoke with today who's going to retire in May? What do I need to give to him so he won't pay a penalty?
He will just have to prove that that what he had was credible, and so there is a form that he would fill out to submit to show that his employer would.
Well,
I believe his employer signs the form.
I will give him that form.
Yes.
He will give that form to his employer. Yes. He will get it completed. Then this year, the Social Security website has done a wonderful job. Now, if we enroll in Part B online together, it says, hey, download your document here. And it's slick and it works well.
So he will not have, as long as he applies for Part B within 8 months of quitting his job and no longer having insurance through his employer.
I'm quitting. I'm leaving. I'm done. May 1. It will not, 8 months will not be anywhere in the equation.
That's right.
Done. May 1.
But for someone who maybe loses their job, not voluntarily, they may not be thinking, I'm 67, I just got fired. Ooh, I've got 8 months. They might,
No. I hope they think faster
Yes,
than that.
yes, we hope
I'm
so.
67 and I've been fired and I lost my health insurance.
Exactly.
I need to figure out where to
Exactly.
get that from.
Yes,
now.
let's hope so. Yes.
And call 1-800-ERICA. That didn't work.
Yeah.
Close.
What's your website?
EricaMedicare.com.
What can we find on there?
Trainings.
You have trainings on your
information.
website?
I do.
Wow.
The ABCs of the
Oh, the classes.
the classes. I'm sorry.
Yeah,
not,
the,
yes,
yeah, okay.
The classes.
Educational.
Yes, educational class. And
Yeah.
and you can book an appointment with me and read my reviews from my clients.
Mm-hmm.
Yeah.
Mm-hmm.
Do people use that website?
I believe they do. My
No,
my
I know they
stats
do.
show they do.
There you go. Yes, they do.
People clicking.
Yes. We love clicks.
Mm-hmm.
And then, of course, the prescription drug plan, which is considered Part D, that also has a penalty if you don't have drug coverage for 63 days. And if you go 63 days without drug coverage, you will also get a penalty, which is 1% of the national premium for the year. And every year that changes, and that penalty will also carry with you.
What is it this year?
$34.70. So 1% would be $3.50.
And that never goes away, right?
Never.
Never.
Well, it's so 34 cents per month times the number of months they didn't have it and should have.
Yeah. Not a
Okay.
big penalty.
Yeah, so that's nothing.
No, well, but if, something happens and you go from taking no medications to taking a very expensive medication, which we all know most medications that are for anything serious are very expensive, then you're going to have to pay that until you come along an open enrollment, which is January 1st to March 31st, to where you can get the prescription drug plan.
No, that's actually, you're thinking about Medicare.
Yes. Yes.
Yeah,
Okay.
for Part
So-
D. So just say that again differently. Yeah, you're
Okay,
good.
so Part D is whenever you have an open enrollment. I don't know when that open enrollment is. I forget.
Annual enrollment period.
Annual enrollment period.
I think between October 15th and December 7th, you can enroll in a plan, a standalone PDP. It'll take effect January 1 of that following year.
There you go. That's it. Yeah.
Yep.
So, but if you get on a medication in October and it's $5,000 a month, you're going to pay October, November, and December because it's not going to be effective till January 1st.
We have penalty calculators in our systems, which are really cool. I met with a young lady who's like 78, I think. She had a Med Sup only that's getting pricey. So before we looked at Medicare Advantage plans, I wanted to know what her penalty was going to be. And it was like $48 a month penalty.
On top of the premium.
Well, we're going to look at it. So I said, we're going to look at Medicare Advantage plans that don't include prescription drugs because you said you don't take any, and we don't want to pay a $50 a month penalty if we don't have to. And so there was 6 options for her to look at, but I explained to her, if you ever work with anyone else, they better know what I know, but they're probably going to enroll you in a plan that includes drugs, and you're going to pay that penalty.
And that penalty, I believe it comes, Social Security automatically takes that out. And because I've seen several of my clients that have gotten letters here in the last 30 days, 60 days since January that say an additional amount. And they've brought them in because they didn't understand them. And it was because they had a penalty that they weren't aware of because one client in particular, her insurance company that she is with, it's a retired employer. She's actually 91. And the company decided to have a prescription drug plan. So they enrolled her in it automatically because she didn't send the letter back saying she didn't want to be enrolled in it because she's 91 and takes 4 drugs that cost a total of $4. So she's fine right there. But then Social Security sent her a letter saying that she was going to have a penalty going forward, and it was because she's never had prescription drug coverage.
She can't disenroll from the plan?
We're trying. That's what we're trying to do. But
Can she qualify for extra help?
She does not.
Okay.
No. In fact, it's that she has some IRMA money too.
But she could disenroll and go to was she Med Sup and PDP?
She just has. It's just a retirement plan. She just has a Medicare A and B and her retirement plan.
And it's the retirement plan that's charging her a penalty for the D?
No, it's Social Security is
Their company
decided
contracted with some D company and enrolled her
because she
Yep.
didn't send
because
the
she
letter
didn't
back.
say I didn't want it.
Yes,
Gotcha.
I feel like she can disenroll.
we're trying. Yes, that's
Yeah.
we
I would
have
try
contacted the
easily
employer.
once with the company, and then I
Yes.
would try harder with Medicare.gov and file
Thank
a
you for
complaint.
that. Okay, thank you for that because I wasn't sure what to
I don't
go,
know
where
if
to go
you would
next.
like this to be an appeal, a grievance, or a complaint, but I'm contacting Medicare.
Yes, that's good to know. Thank you because we haven't gotten the results back yet from the form we filled out together.
I wouldn't wait very long.
So she was potentially better looking at stuff on an individual basis, not through the group, because our recommendation in that scenario would have been like, okay, well, if she only takes so many dollars a month worth of medications, then we could have assigned her a plan that was a MA only plan and didn't cover drug coverage. She wouldn't have paid the penalty and still be paying $4 for her drugs.
She is very loyal to the plan that she has. So she didn't want to switch. So this is another. I guess she's not really a client, but she's another person who
Yeah.
I'm not selling her anything, but we are working through this to get her.
Yeah,
To get it.
she still works. She has employer coverage.
Nope,
which,
she doesn't-
Okay,
no, yeah.
so she's retired, but she thinks it's good.
She loves it. She
And
loves
that's
her insurance.
cool.
Yes,
That all of her friends are not the same.
right. Exactly. And
Yeah,
you know what?
it's
And,
awesome.
And she said she could sleep that night when she
Yeah.
left here.
Yep.
She said, because you talked me through this, you helped me fill out the form. We called the insurance company together. She said, I will be able to sleep tonight, and I haven't slept in a week. So she's going to
Isn't that
tell.
awesome?
It is. It
That's
is.
awesome.
Yes.
She left here, and I was like, this is why I do this. And she will tell her friends. She'll tell
Yes.
anybody she knows that has
Correct.
questions about Medicare to come to see me. There's no doubt about. I don't doubt that at all. In fact, she asked me. She said, "So how much do I owe you for this?" And I said, "You don't owe me anything." She goes, "Well, I have to give you something." I said, "Well, that would be illegal. So no, you don't owe me anything."
Right.
So yeah, it was. Again, she left, and I was like, "Wow, this is why I do this, and this is why I do this with this group of agents, because I know that that's the heart of the Medicare Resource Center."
What do you say to the person that approaches you? And I'm asking everybody here, but mostly Erica. I don't know if that made sense, but anyway. What do you say to the person that says, hey, I'm turning 65, I want to work with you, looking for a plan, but I don't take drugs, and I never have. What do you say to that person that is hesitant to enroll in a Part D program?
Well, if they were going the supplement route, I would try to find some type of prescription drug plan that was a minimal cost, because even if they just got their immunizations, because we had a client like that. I mean, she had to pay a penalty, and really all she wanted was the immunizations, but she waited, and so then she had to pay a penalty. So I mean, but if the Advantage plan, it wouldn't matter, because for one that had the prescription drug included. But I would still encourage them to get the prescription drug plan, because the what ifs in life. That's why we all have insurance, is the what ifs in life. So,
But what if they're okay and they say, listen, I'll just pay the penalty. It's only 32 cents a month. I'll just pay the penalty and you can enroll me at a later date and I won't care. And I'm okay with that.
well, to be quite honest, in that case, I would do what the client wanted after advising them what my opinion is. I would show them, but if they still wanted it, I would just make sure I noted it in my CRM and move forward. And next time I did a review with them, I would probably hit it every time I reviewed with them.
I think I would explain, I would say, let's see where you are. Again, this is based on zip codes and counties. There's a plan this year that has no premium. That's affordable. So we would just go ahead and have a drug plan. So the piece of plastic costs you nothing this year. So we don't have to worry about a penalty in the future. But if you really don't want to enroll, okay, I'm going to explain to you that it's February, and that if in March you decide to come down with the cooties and they give you a prescription that's very pricey, I cannot enroll you in March because that's not an election period. I got to wait. We got to wait. You got to eat whatever that thing costs You got to pay that until next October. Then we can look at what's available for 2025. And in October, I can enroll you in a plan that you're going to pay a penalty for, and it won't take effect until January. How about we sign up here right now on this one that doesn't cost nothing?
That's, yeah.
Well, I have a story. I had
I
two.
love stories.
Good.
We all love stories.
All right, children, are you ready for a story? This is
Get
a
my
true
blankie.
story. So I had a lady call me, and she said, "Hey, I got your number from so-and-so. Let's set an appointment." I said, "Cool, let's come to the office." And she goes, "No, I want to do a home visit." I said, "Okay." I can do a home visit. So when I got there were two ladies, and they were older, and both of them in their 70s, and both had never enrolled in a Part D program. And so I calculated the penalty for them, and I was going to be like, for one lady, $30-something a month, and the other lady, like $40-something a month. And they say, we pay less than that for just we're paying out of pocket. We haven't had Part D. I don't want to do it. And I said, okay, but you must know that if you do, I know you're not, you're paying minimal for drugs now, but if you get put on, like you said, one of those really expensive drugs, I will not have the ability to get you enrolled in a plan until 2025. I just want to make sure we both understand that. And they both said, we both understand that. This is great. That's the decision. And I said, okay. I put that in my notes. One of those ladies called me and said, you're not going to believe this. I got the cooties. And I got put on a medication. I went to go buy it. I'm used to paying $1 or $2. This little medication was $780. Please help me. I'm sorry I didn't do it. And I said, I'm sorry, there's nothing that I can do. I don't have a special enrollment period. I can get you a plan in 2025, but between now and then, you are going to pay that $700 and something for that medication all the way until January of 2025. So the point of the story is this. Sometimes it makes sense to pay the penalty because you don't know what the future is, to your point.
Right.
Hey, man, we did that good. You know what I'm saying? It's pretty good, Connor.
Thank you, baby.
Hey, speaking of penalties, and we want to let people know that we're not the reason you have the penalties. Okay, so I know everyone knows what I'm talking about. They kind of look at us. Penalties, we're not the one.
Now, here's where you are responsible. And Jason and I have both had this happen to us in our careers that have been a while, is if we forgot to mention the income. And we did help them, and their Part B was more than we thought it was because we didn't talk about their income. But that was a long time ago. That is every conversation, because, it was a pretty good friend of yours on your story.
Oh, yeah, it was my pastor.
Yeah.
Like the relationship with, you talk about wanting to do ethical when you do an appointment with your pastor of your church. And I that's a big church at that point in time. Really big church. Yeah. He didn't bother to tell me that he wrote a New York Times best-selling book 2 years ago. So when his Medicare premium came in and it was over $500 a month, he asked me why I lied to him. Right. And I'm like, I did? What's going on? And then we talked about the book, and I should have asked the question.
And we do now.
Yeah, we do now.
And we've
Yeah.
learned from your mistakes because you
Yeah.
train
Thank
us.
you. Thank you.
Yeah, yes.
Because you train us to
True.
look. You train us to show them that chart. So,
But I was able to file what's called, nobody's named Irma in here, right? Irma's an ugly name, but income-related Medicare adjusted amount. You were talking about it earlier. We were able to file an appeal because this is 2 years later. He wrote that book 2 years ago, and that was income from 2 years ago. That's not his income today. We appealed it, and we won it, and we overcame it. And his premium went down to what it should be.
And
So-
he promised never to write another bestseller.
yeah. Yeah.
there's the moral to that story.
Yeah. But
What about a guy? Can you keep contributing to your health savings account once you enroll in Medicare?
That's a
who
great
wants
question.
to tackle that one?
The answer is no.
Okay, thank you, because I had no idea.
The answer
Oh, I
is,
knew that. I mean, I
Yeah,
don't
everybody
know.
knows that.
the answer is no. I learned
Yes.
that from one of my
They
good
didn't know.
my good friends, one of my car dealers.
Interesting.
Yeah, I did
Yep.
not. Yeah, so
we can't mention names because I was going to throw a name out there, but I shouldn't do that.
You just
You
mentioned the
shouldn't.
social security number. You'll be
Yeah,
fine.
it'll be safe. It's fine.
He was one of my favorite Cadillac dealers in Lebanon, Ohio.
Website.
Yeah.
But to your point, Scott,
Yes.
it's oftentimes I have to deliver bad news to people, and I hate doing that. But I am just the messenger. I am not your emotional pincushion. Like if I give you bad news, it is just because it's the truth, and I know the truth feels like you're getting raked across the back with a cheese grater, but I'm not the source of it. I'm just the deliverer of the information. And I hate delivering bad news. I don't like doing it, but it's my fiduciary duty to let you know the good, the bad, and the ugly.
That's part of what we do. And if someone calls an 800 number, you think they're going to do the same thing for those people? Absolutely not. They're going to get them in a plan, get them in quick, get it on the books, and be done with it. Not here. We don't do that.
Yeah, we have offices. We could hide, but you would find us.
Yeah.
We're year round, and this is all we do year round.
Well, I have a lumber yard on the side.
Except for your wood company that some people,
SD.
they don't know what that means.
Sawdust.
Sawdust.
Yeah.
So delivering the bad news, that reminds me of one of my favorite stories from another one of my car dealers who said, Connor, I'm delivering bad news. Connor, I don't mind eating a turd sandwich, but can I just have it one bite at a time? Do you have to shove the whole turd sandwich down my throat at once?
Sometimes it goes down better.
Just go.
That'll get a click.
Yeah. Click
Yeah,
away.
that will.
That'll get a click.
So
And your French fry socks.
Let's go, French fries.
Yes, I love
good
it.
looking socks.
Those are.
So I think my main recommendation, we have an educational presentation that we do called Medicare for Employers, and it's designed to help that employer understand the beautiful benefits of Medicare. Like the Pew Research poll that was done, these employers are paying more for group health care than they've ever paid in history. It's an absurd amount of money. And with, a third of the population working past age 65, this is one of the most amazing solutions. It's a win-win-win for everybody. My normal default answer is that if you are turning age 65 and you are still working and you're getting insurance through your employer, you would be absolutely crazy not to sit down with me and at least look at what the options are. It isn't 100% guaranteed that you're going to do something better on an individual Medicare plan, but I would say if I were to guess in percentages, 90 to 95% chance you're going to be better off on doing something on your own.
If you think better insurance for less money is better.
Yes.
Right.
If you think you want to get better benefits for less out of pocket and not have to work full time to get it, then I would say, yes, that's a good possibility. But if you think all those things are stupid and you want to pay more, work more, and get less coverage, by all means, ignore us.
And if you really, really love your job, you might even, if you still want to work, you could always negotiate with your employer and possibly have them help you with the Medicare premium instead of paying what they're paying for you.
Like, how would that look? What would you say if I were your employer and you were talking about going on Medicare? What would you say?
If you're paying $900 for my insurance, your part, and then I'm paying for my part, I can get insurance, Medicare's A and B, and an Advantage plan or whatever, supplement, whatever, and it'll cost you as the employer. My cost is $174.70. So if you paid that, you would be still saving $700 a month as my employer, and that could be negotiated, or they could, they could bump up your salary, and then you wouldn't have insurance, but yet that your salary adjustment might cover your insurance through Medicare. I mean, your employer, again, it's a win-win-win. Your employer would save that money. You would have better coverage, possibly, most likely, almost definitely have better coverage, and then everybody would be saving money. And I don't know any employer that doesn't want to save money.
I hope you employers are watching this and you're listening, because if you have employees that are age 65, you should offer them a stipend. Say, hey, because legally it has to be optional. Here's our plan that's costing X amount of dollars, and here's the benefits. And they don't even disclose what the employer's paying. But how about this? How about I give you, say, I don't know, $400 a month infused in your paycheck. That's a pay raise, and now you can go out and get your own Medicare plan. It's a win-win for everybody. I hope your employers are listening to this, because we know that 49% of those folks that are turning 65 do not respond to any of the marketing that's sent out because they have group health insurance, and they are making a massive assumption that they are better off there. And the reality is they are not. By and large, it is way more likely that you're going to be better off on an individual plan. So why not go to your employer and say, hey, would you mind giving me half of what you're already paying infused in my paycheck? I'll get off of your group plan, get an individual plan. And by the way, all the people age 65 and older, as far as group insurance goes, they're higher risk. So if you get the higher risk people on your group plan off and on individual plans, your rates can go down for the group. It's an amazing solution. Inflation's through the roof. Employers are looking for a place to go to save money, and we have that solution.
Absolutely.
Definitely.
Human resource directors that are watching this, give us your roster of your people that are 65. We'll run a comparison. You can look at it. You can go in and tell the boss man or the boss lady, hey, this is a great way. I think we could save a ton of money. It would be great for your organization.
Yeah, we're not going to come in and disrupt your day. We get it. You run your own business. We're not going to come in and tell you to shut the place down for 6 or 7 hours. We'll get together with you, and we'll
send me the information.
Yeah.
I'll tell you, here's how much it would cost.
Yeah.
That's how long it's going to take.
You want to maybe lower your overhead at the lumber yard a little bit?
Yeah, man.
And then the HR director looks really good to the CEO as well.
Correct.
Yeah.
Of course. And there's
Might be some bonus there too.
There's even certain scenarios where if you have enough people that are age 65 in the workforce under a one group entity, and that secret number is 100 or more, you literally can have your employee logo put on the insurance card that you don't even have to pay the premium for. It's brilliant. The perception is if you're an employer and you could say things like this, hey, we have our own healthcare plan after age 65.
I mean, we did that for Will's Lumber. I mean, it was
Yeah, we did. Look at Will's.
Yeah.
Look at them.
Yes, you did.
They got a Medicare supplement card with a Will's Lumber logo right in the bottom corner. And people are like, wow, I get this through my employer. How kind of them to do that.
Yeah.
And
You're
that
welcome.
employer
You're welcome.
can pay as little as $0 to do that.
Mind blown.
Knowledge.
Is
Everyone.
Power.
Knowledge. You tune into the Medicare Academy podcast. Knowledge.
You know why?
Why?
We teach Medicare.
Everybody who watches this gets more smartlier.
Yes.
Out there, doesn't it say we talk Medicare?
We talk it there, we teach it here. Connor.
Okay.
Different rooms.
It's been it's like the clock says, like,
done.
Seth went like this.
3 minutes.
All right.
Unless somebody got something funny to add. You got a funny story from the week? Funny enrollment?
Did Rod get in?
Oh, was that Kirkham's?
I'm pretty sure it was because it was him there, and then it wasn't very
Yeah.
long ago. I hear he took your computer. Yeah.
If it was him, I know where to find it.
Well, we're good. Thanks, everyone.
Yeah.
Happy Friday
This was
to you.
fun again. Are we going to do it again?
Oh, yeah.
Yeah.
So
Sure
people
of
got
it.
something to look forward to.
That's right.
Yeah.
Yep.
Maybe start digging into some other things.
So that's interesting. Why don't you put together an email? I'm serious.
All right. I know you are. I'm just giggling.
Yeah. Email to the 4 of us, including you.
Okay.
Here's what I want to dig into more.
Because I am getting feedback, and it's really good feedback.
And this is how we build this stuff.
Yeah.
I was very happy. I told him, I said, I'm glad you sent that email
Yeah.
because it gives us, okay, here's sort of a purpose
Yeah.
in our map.
I'm glad.
But yes,
I'm glad I give you purpose.
you do.
And if anyone's watching this, they can comment, right? I've gotten comments on my Facebook page and stuff. That's going to help us. I mean, we're just starting this thing out. This is really our third one, but really our second.
What?
It feels like our second.
It's second, but we did that one we were holding the mics, remember?
Yeah.
So if we get feedback and input from people, it'll help us.
It will.
Yeah.
Yeah. It's like a straight gateway to talkmedicarescott.com.
Yeah. TalkMedicareScott.com.
Talkmedicarescott.com.
Wow, that's an awesome jingle right there.
Ooh, I
We're
like
onto
that.
something.
We should
That
get
was
matching
awesome.
tattoos.